Hello friends, today we'll be talking about the use of closure devices for the treatment of what is called a hole in the heart. Most PFOs, which stand for Patent Foramen Ovale, are completely benign and nothing really needs to be done for them. But in some patients, the PFO or Atrial Septal Defects or ASDs can be large or lead to complications.
He's had a saddle pulmonary embolism, which is a clot that goes from the legs toward the right ventricle, and then from the right ventricle goes into the lungs. And can get stuck in the lungs. And there was a question of a stroke that was raised to see if he has an ASD or a PFO, which can explain both of these.
So how can an ASD or PFO explain having a stroke in someone who has had a pulmonary embolism? Well, normally blood clots in the right or venous side get dislodged and travel to the heart, can only get to the lungs because there is a wall that separates the right and the left side called a septum. However, if there's a hole in the septum, then a clot could travel from the right to the left side, and then from the left side could travel to the brain and cause a stroke. In other people, there may be shunting of blood leading to problems with oxygen levels or pressures inside the heart, which might be a reason to close the hole. So how do we find out if there is such a septal defect? Well, we perform what's called a transesophageal echocardiogram or an ultrasound of the heart, where we insert a probe that sits right behind the heart so that we can get clear images. From there, we can interrogate the septum using color Doppler or perform what's called a bubble study to make sure that no bubbles cross over from the right side to the left side, indicating there's a hole. Large enough PFOs can just be seen using the echocardiography itself. So how do we fix these defects? We can use closure devices which are inserted via the femoral vein and taken up the IVC to the right atrium. Once there, we get through the defect using a wire and then advance the inserted device in a compressed state. The device has 2 discs. Each disc is larger than the hole itself so that it won't slip through the hole. We expand the left atrial disc and the tip of the device in the left atrium, and then pull the system back so that the disc sits against the left atrial side of the septum. We then release the right atrial disc so that we now have a disc on each side of the hole and effectively close the hole, and any chance of shunting of blood or clots getting through that defect are minimized. Here are a few examples of the device being used. The septal occluder device is an elegant way of closing intracardiac defects without the need for open heart surgery. If you found this video useful, then please share it with your friends. Hope you're doing great, and I will see you next time.